Tonight on Let It Rip.
This virus is extremely explosive. It is probably one of the most, if not the most, contagious virus that we have seen in the modern era.
New Year's, same pandemic. Now the Omicron variant is sweeping the globe, and Michigan and even the fully vaccinated are getting infected. The record-setting new surge causing major staff shortages at Metro Detroit hospitals, businesses, and schools. And it is time to let it rip. On the panel tonight, we're talking about two doctors who we've had on many times during this relentless pandemic. Dr. Farhan Bhatti, the medical director at Carefree Medical in Lansing, and Dr. Michael Basuito, a reconstructive surgeon and a member of the Wayne State Board of Governors. They don't always see eye to eye, but they have the same goal, ending this terrible pandemic. Also joining us tonight, Troy Public Schools Superintendent Rich Machesky, who can also tell us why most schools right now are open, but some have gone remote during this latest surge. And we all know, of course, Fox 2 anchor attorney Charlie Langton, but we want to begin tonight with Dr. Justin Skrinsky, an internist at Beaumont Health. And Dr. Skrinsky, good to see you. Interesting note to begin our discussion tonight. Your hospital system taking out a full-page ad in several newspapers warning people that your hospital and others are at a breaking point right now. Talk about that.
Yeah, it really is a critical point right now. For instance, the past several weeks, we've been seeing this very, very high number of patients from the Delta surge. Now that Omicron is here, we're seeing much, much higher patient volumes. We're really concerned because not only do we want to take care of all those COVID patients, we've learned from the previous surges, we need to keep space available in the hospital to take care of all the patients, even the non-COVID ones that are coming in for emergency issues.
You know, we keep hearing different numbers out there, Dr. Skrinsky, about the percentage of people who are sitting in the ERs right now and in the emergency rooms who are unvaccinated. Can you give us an accurate number that you're seeing there?
Right. So right now it's about 60% unvaccinated, 40% vaccinated. And again, these are varying levels of severity. I think one of the important things is that we only see single digits, so maybe about 5% or less boosted.
When we look at this, Dr. Bhatti, I want to bring you into the mix here. When you look at this surge compared to the surge we saw 2 years ago, give us an idea as to what makes this so different.
So what makes this different is that the level of transmissibility of Omicron rivals the level of transmissibility of like measles. And so because this spreads so much faster, the number of cases is rising exponentially. I mean, hospitalizations just in the last week are up 31%. Over the last 2 weeks, hospitalizations are up by 50%. And amongst children across the country, hospitalizations are up by 100%. And so that's what makes this different, is that this spreads so much more readily. Even though on the whole, the symptoms are less severe than Delta, because so many more people are getting it, still we're seeing an increase in number of people that are needing hospitalization.
You know, you're hearing a lot of people say this Omicron is very much like a cold in many cases. In fact, so many people that we know say, look, I had a head cold, I had a fever, I didn't feel so great, but it wasn't as bad as I thought it would be. When you hear people say that, does that worry you a bit?
It does, because it's true. Look, a lot of folks are getting milder symptoms with Omicron, but we as physicians don't know who those folks are going to be. It's not written on our foreheads who's going to get COVID, Omicron, and who's going to get mild symptoms, and who's going to get Omicron and get really sick. We can't reliably predict who's going to be in what category. You can't predict based on age. You can't predict based on many factors. And so that's the problem, is we don't know who's going to require hospitalization and who's not. The only predictor that we have is vaccination status. Otherwise, it's anybody's guess who's going to get better quickly and who's not. That's the problem.
Dr. Basuito, when you hear Dr. Bhatti talk about that, your thoughts on that? Right now, the Omicron variant does seem less severe in many cases. What's your take on it right now?
No, if you look at the natural history of pandemics, when this happens, it usually signals the beginning of the end. And this is good news. Now, if you think about the 1918 pandemic, it lasted 2.5 to 3 years. Now, what is a pandemic? It means you get a virus that infects humans. It's highly transmissible, and there's no pre-existing natural immunity to it, and that's why it spread so fast. How do we get rid of pandemics? One is with vaccines, and the other one's with natural immunity. This Omicron is what's imparting natural immunity on the population, and it's going to get us to herd immunity. Now, the 1918 pandemic, We didn't have vaccines back then. We didn't get vaccines till the 1930s. Did it go away? Yeah, it didn't go away completely. We still have remnants of it, but it's now endemic. It's not pandemic. We had the H1N1, same thing. It went away a little sooner because we had vaccines. The vaccines had to go away a little sooner. How do these pandemics end? Number one, either natural immunity or vaccines. And Dr. Body and I agree that vaccines are lifesavers, that vaccines help. But when you see the symptoms, just like these past pandemics that have occurred, the natural history is toward the end, they get very, very contagious, but much more mild. And really, they're acting like boosters. Now, unfortunately, we've got an administration now, instead of having a warp speed, we got snail speed. And if you want to doubt me, look at the testing lines for people who need a test. There's no tests out there. But we got vaccines, but, we have a one-trick pony administration here. Nobody's talking about therapeutics, and nobody's talking about natural immunity.
Well, let's Dr. Basuito, to be fair, this administration is introducing tens of millions, if not more, of test kits that they're going to be putting out there. So they'll be hitting drugstore shelves very soon. They promised that at the first of the year. And also the COVID pill to the number of more than 10 to 20 million expected to hit the shelves as well after being approved by Pfizer. That's good news, right?
Well, they knew last year that we were going to have a flu season this time of year this year. And we see miles long of lines of people waiting to get tests. There's no tests. I mean, that's
and the tests are important, and it is very frustrating right now.
Wait a minute. What do we need to talk about a test for? If you get the vaccine, mandate the vaccine, you don't need a test, right? Look at the Dr. Skrinsky stats. 60% of the people in the hospital are unvaccinated. Dr. Basuito, I thought I was fall off my chair. He said, you need the vaccine. I read it. I wrote it down right here. He said you would get the vaccine and you can stop this thing. So mandate the vaccine. What are we doing here? Mandate it.
80% of the people in my ICU here in Lansing are unvaccinated. So the ones that are really, really sick, they're still unvaccinated. It's the only predictor we have.
And let's talk about this mandatory vaccine and if that's something that would actually wipe this out completely. Here's the issue that so many people who are unvaccinated and those who are skeptical will say is even with the vaccine, people are still getting COVID. Why is that?
They're getting COVID, but they're not getting sick. The overwhelming majority of people that got vaccinated who then test positive for COVID-19, they have mild symptoms of a runny nose and a slight cough. That's what happens.
It's like a hangover. It's like a hangover.
Dr.
Have you ever had a hangover? Okay, there you go. Get the vaccine. The worst you're going to get is a hangover. That's it.
Dr. Skrinsky, and Charlie's right. Many of the people who are getting this, it is not a big issue for them. But I want to talk a little bit about what people should do right now at home who are dealing with this. And they're really frustrated. There are people who have been exposed to somebody who had COVID, that means 15 minutes or more in direct contact without a mask, within 6 feet, who are exposed to people at holiday dinners, a New Year's Eve party, a dinner party, wherever. They don't have symptoms. Should they go try to get the test right now, Dr. Skrinsky?
Well, honestly, with as much as testing is in short supply, honestly, I think the people who are symptomatic, those are the people who we should definitely prioritize testing for. The home kits, we still need to validate how accurate those are, especially with things like the Omicron variant. In terms of especially going to situations where you might be seeing somebody elderly, immunocompromised, if you're going to be around people, especially unvaccinated, coming out of those situations or going into them, that might be a good reason to get tested, even if you are asymptomatic. But really right now, especially with the crunch that we have, it's probably the people who are symptomatic or have had a confirmed exposure probably best suited to get those.
Dr. Body, what are your thoughts on that right now? Because so many people are saying, wait a minute, I don't want to take a test away from someone who actually has a symptom. If I was exposed to someone, should they go out and get a test?
If you live in a place where tests are plentiful and those places do exist, then you should get a test. If tests are in short supply, then I absolutely agree with my colleague that you should reserve the test for people who are symptomatic. What I'm looking forward to is a time, hopefully, God willing, where we're worried as much about the number of positive cases anymore. What we're worried about is hospitalizations, because that's really the main driver, is we're trying to preserve precious hospital resources, and hospitals are still by and large full, at least here in Michigan. But if we ever come to a place where a bunch of people are testing positive, their symptoms are mild, and they're not requiring hospitalization, then we've done our job, then mission accomplished. So the main thing that we need to be looking at is how many people are getting sick to the point where they're requiring hospitalization, and how many people are still dying from COVID. And those numbers are still way too high. So we still have work to do.
Rich Machewski with Troy Schools, the superintendent there. Let's talk for a moment about schools, and we'll continue the discussion on the other end of this. But let's start by asking the question about schools. Why are some districts choosing to go remote, and yet other ones are saying, look, let's have in-person class? What are you folks doing right now, and why do you think it's different in some of these larger districts like Detroit?
Well, Roop, for us in Troy, our primary focus has been from the very beginning of the pandemic to get our students in seat face-to-face as quickly as possible while maintaining a safe environment. That's a significant challenge now for districts that are still in seat, primarily due to staffing. We were challenged with staffing before the school year even started, and sickness associated with the Omicron variant causing more teachers to become sick, their children to be sick, and them have to stay home. Our substitute teaching pool, which is already a very shallow pool to begin with, we have those individuals getting sick. So the ability to have individuals in our buildings helping support day-to-day instruction has been significantly limited. I think that's what we're seeing in some of these larger districts that have chosen to go virtual. And at the same time, the vaccination rates amongst districts varies significantly. There are some districts that are highly vaccinated, like Troy is one of those districts, and I think multiple districts in Oakland County, high vaccination rates. There are other districts, especially in some of our large urban settings, that have much lower vaccination rates, and that creates a situation, in particular with the veracity of the variant itself, that they feel it's dangerous to have students in class. I can't speak entirely for them. I can certainly speak for what we're doing in the Troy School District.
Yeah, Charlie Langton, we know, of course, that right now the Detroit Public Schools, we're seeing a high infection rate in the city of Detroit itself, a high positivity rate. That school district, of course, saying, you know what, we're going to go ahead and take this remote. The big difference here, but the president has said, hey, we need kids to get back into class. And that's something that Republicans and Democrats can agree on here.
Agree on, but how do you do it though? And as I understand the numbers in Detroit, I checked them out. Positivity rate is 40%. What does that mean? That means of everyone that tests for COVID, 40% come back positive. I'd switch it around and see what the negativity rate should be. It's 60% negativity rate. Do it that way. And you want that negativity rate to be 100%. Listen, we can make numbers do all kinds of things. The bottom line is, from what I'm hearing from the superintendent and from all these doctors on the panel, is that the more you get the vaccine, the more options you're going to have to go back to in-person school, to work, to pretty much live a normal life. And so to me, the issue is going to be, if those numbers are accurate, more vaccines equal more freedom, why don't we mandate it in some way? And I think the way to do that is the government. And actually, I think it's legal. The president, the mayor, the health director, we can dick around who should mandate it, but it seems to me that someone in authority should mandate the vaccine, and that'll be the best way to get back to a normal life.
And we're going to tap into your legal expertise about this in just a moment. Also, on the next segment on Let It Rip, we're going to be talking about why some believe that Omicron might actually signal the end of the pandemic. You heard one of our doctors say that already. If so, what does that look like? Will it end just as quickly as it started? Or do we see a gradual, perhaps months or years decline? We're going to take a look at that. Plus, flaws in our system. What did the pandemic expose? We'll take that on head on when Let It Rip continues after this. Welcome back to Let It Rip. We're taking on, of course, the coronavirus, the Omicron variant in particular, what it's doing, what it will do, and what can be done about it. Joining us now are our esteemed panel of doctors, and also Rich Machewski, the Troy Superintendent of Schools, and Charlie Langton, of course, with us as always on Let It Rip. Dr. Bhatia, I wanted to get right to you because, you talk a lot about the vaccine and why mandates would be perhaps important. You actually have firsthand knowledge of what that looks like. You're a school board member in Lansing, and you've done something as part of that board together to make sure that mandates are a thing out in Lansing, right? Talk about that.
That's right. So at the onset of the school year, we were the first school district in the state of Michigan to mandate vaccines for all of our staff. We did include an opt-out for regular testing, but we mandated vaccines. We were the first one to do that. And we've had a ton of success as a result. We've only had a handful, I think 10 cases of students getting sick with COVID and having to quarantine. So we've done a really good job. Now, we did join Detroit and other school districts in the past week going remote. We're going to be going back in person this coming Monday. We did that because we were worried that there was going to be staffing issues, that maybe up to half of staff in the district might be calling in sick those first few days. And so out of an abundance of caution, with staffing shortages, we went remote for this week. But we're seeing a lot of success in Lansing, and I think other school districts ought to be able to follow our lead in that regard.
You know, you take a look at the vaccine mandate in Lansing and the effects of it. Dr. Basuito, when you see those results, those numbers, your thoughts on that? Should that be something that all school districts take a close look at, and perhaps other members in the private sector?
No. You know, Charlie's way, we're not going to test our way out of this. Dr. Body's absolutely correct. What we want to do is we want to prevent people being hospitalized and getting sick. We want to prevent deaths. But what Dr. Body and Charlie are proposing is to use a stick. I think a carrot works better. They want to take a chainsaw to this, and I say, let's use a scalpel. I'm a surgeon. I'm better with a scalpel. Why would you force someone to get a vaccine if they already have natural immunity? Remember what I said, the three ways out of it are therapeutics, natural immunity, and vaccines. Well, why do we ignore natural immunity? When a nurse comes up to me and says, I'm 32 years old, I want to have babies in the future, I'm worried about the vaccine, I've had COVID, I've got natural immunity, who am I to force her to get a vaccine? You know, Ben Franklin said anybody who gives up liberty for security will end up with neither.
Dr. Basuito.
But Dr. Basuito, 80% of the people at the hospitals in Lansing right now who are sitting in the ERs are unvaccinated. It doesn't seem as though that herd immunity is really taking place there, does it?
Well, like I said, this is the beginning of the end. This Omicron is going to sweep through. And if it follows the same natural history as all the previous pandemics that came before it, this is the beginning of the end. And it doesn't go out with a bang, it goes out with a fizzle.
But what about the fact that you have these people?
COVID?
Yeah, that's a good question.
It's undeniable. The science is undeniable that natural immunity is not as robust as vaccine immunity. You cannot argue that, especially if your natural immunity came in the form of the Alpha variant or the Delta variant. You're not going to be really well protected against Omicron the way you would be if you received a vaccine. Those two things are not equal.
Dr. Skrinsky, what are your thoughts on that? What are you seeing? You're actually right there looking at the COVID ward on a daily basis right here in Metro Detroit. Beaumont, as we mentioned at the beginning, taking out a full-page ad saying, watch what you're doing because we are overwhelmed. Do you agree that natural immunity isn't as strong as vaccines?
I do. And that's actually borne out in the data that, those who are vaccinated much less likely to be reinfected with COVID. And now one of the big issues that we're having is reinfection because, again, the previous surges we had different variants. The Omicron variant's kind of a whole nother animal. Also, in terms of, I completely agree with my other colleagues as well, is that if we can prevent the hospitalizations, that's the key thing. If vaccination is going to turn COVID into the common cold, then again, it doesn't matter what our overall numbers are, just as long as we're keeping the hospitals empty, we're keeping the ICUs empty.
But are the people in the ICU, have they had COVID before? In other words, they could make an argument that they've had natural immunity, but their symptoms are very mild, just as those who can get COVID after having a vaccine.
Well, I couldn't speak to the people in the ICU who have been previously infected, but I can tell you, just as been mentioned before, as you go up in severity, so the most severe patients, the fewer the breakthrough cases. So as you get into the ICUs, more and more percent are unvaccinated.
Right.
Do you agree, Dr. Skrinsky, what you heard Dr. Basuito say just a few moments ago? He said basically it looks as though Omicron, being this weaker form, is this fizzling out of coronavirus. Is that how you see this as well? Or do you have a different take?
I would definitely hope so. And again, it is for how contagious it is, it's definitely inoculating a huge portion of the population. So whether or not you wanted to be exposed to it or whether or not you're vaccinated, so many people are having Omicron. I think it's worth pointing out too that Delta, though, is downstream from the original strain of COVID as well. And that's a more virulent one. So my hope is, fingers crossed, that this is the beginning of the end. I would love that to be the case. I guess time will tell, however.
Yeah, they say viruses don't want to kill off all of the hosts. I hate to sound so callous, but instead the viruses want to survive. One way of doing that is to maintain itself within the host population. And maybe perhaps, as you're indicating, that could be what's happening with Omicron. Hey, I want to talk a little bit about what this pandemic has taught us. It's poked a lot of holes at a lot of aspects of our lives, from supply chain to politics to education. Rich Oczewski, superintendent of Troy Schools, your thoughts on what this pandemic has taught us and what we need to learn from it.
Well, from my perspective, I think what it's taught us is the importance of being flexible. It's also taught us the importance of school districts being allowed the ability to have the flexibility and the space necessary to make the adjustments in their schedules, to make the adjustments in their school days in order to address the needs of the various students that they serve. A very strict day and hour requirement by the state of Michigan, we realized very quickly last year, does not help us support the needs, adjust our schedules in order to address the issues that the pandemic brought forward. So we need help, we need space, and we need the time necessary to make the adjustments to allow for school districts to evolve in continuing to meet the needs of their kids.
Charlie Langton, are we ready for another one when this one goes away?
Another virus?
Another virus? And another issue like this, yeah.
Here's the thing. I think we have to agree on some parameters. And I think that, when you've got the CDC saying now they just limited the quarantine period to 5 days. But I understand, talking to some superintendents of schools, quarantine, if you get a student, it's 10 days. What's the difference? I don't get it. And I do think that all these testing that's going to be done, it's very difficult to get a test. An employer who says you've been exposed, I don't really know what that means. So if my great aunt who just came over from whatever for one dinner and she got it 2 days later, and am I exposed? And if that's the case, then do I have to go wait in that long line to get a test? And if I do wait in a long line to get a test, what is it going to show? Is it going to show positive for what? Is it Omicron? Can you actually take the variant on the test? I think we got too much. There are too many variables right now. I think we should focus on symptoms, and I think we should focus on vaccines. And I think if we just narrow it to that, I think we'd be far ahead.
Dr. Body, what do you do with this type of exposure that people are talking about?
So if you, in Charlie's case, if he's exposed in that fashion and he's asymptomatic, he does not need to go get a test. And the CDC says wear a tight-fitting mask and go about your business. Same thing if you are coming off of being positive. Once you're asymptomatic, it's not that you can just go back to living normally after 5 days. For the subsequent 5 days, you still have to wear a mask. And that's really, really important. That's being left out of the conversation is how many people are going to wear that mask, number one, how many people are going to wear it properly, number two, because according to the United Kingdom, the UK studies show that up to 1/3 of people past that 5th day are still testing positive and can still transmit it to other people. So you're not in the clear after the 5th day. If you're going to be out in public, you still have to wear a tight-fitting mask so you don't spread it to other people.
It's said that 9/11 brought us together, this tragedy, the coronavirus, splitting so many people apart. How does this end? What do we learn and how do we move forward? We're going to take a look at that when we come back here on Let It Rip. We learn moving forward. Dr. Basuida, we begin with you.
I think what we've learned is that for medical problems, you apply medical science, not political science. The 1918 pandemic ended in 3 years without any vaccines. And what did we see after that? The roaring 20s. The roaring 20s. Just remember that.
Dr. Skrinsky, what do we learn from here?
I think adaptability and adaptability over tribalism. It's important to live in reality, roll with the punches, get information from credible sources, and not just stick to any sort of party line.
Dr. Body.
Shared sacrifice. Getting a vaccine is not just about you. It's about those around you. It's about having empathy for the medical workers who are in the hospitals that are full. It's about keeping our hospitals empty so that more people can make it through this thing.
Rich Macheski.
We learned just how important our schools are for our communities and for our economy and for the continued moving forward of our local communities. They're extremely important.
We are out of time. We thank you all for your time today. That does it for this edition of Let It Rip.